Hello and welcome. I'm Danielle Ofri, the chief editor of the Bellevue Literary Review, and I'm so pleased to welcome you to COVID Writing Goes Viral, How Literary and Social Media Writing Became a Lifeline During the Pandemic. I'm so excited to be joined by my colleagues Abraham Verghese and Eric Topol. Dr. Verghese is a professor and vice chair of medicine at Stanford University. He's also a best-selling author of Cutting for Stone, My Own Country, and The Tennis Partner. Dr. Topol is a cardiologist and founder and director of the Scripps Research Translational Institute. He's also editor-in-chief of Medscape. His Twitter account has been considered one of the most reliable sources of information about COVID. His most recent book is Deep Medicine. Welcome, Abraham. Welcome, Eric.
Thank you.
Thanks.
So, we're here kind of at the 1 year mark of COVID. And I'm wondering if, even before we start, if each of you might want to reflect on what the 1 year mark feels like, and then maybe perhaps related to what you've been reading as we hit this 1 year anniversary.
Well, shall I go first, Eric?
Sure.
It's interesting. I was just thinking 1 year ago, I was sitting with my editor in New York, and a little more than a year ago, end of February, and it was a time of innocence. I was very aware of COVID. We had a few cases here in the area, but not many. And they were not, for the most part, blissfully unaware of it. I was very conscious of it walking through the corridors and going to restaurants. And, look at what's unfolded since then. I was meeting with my editor about a novel, and that novel is still, all I've been doing all year, but really thinking about COVID, and I'm sure influenced by the strange experience of being confined to some degree, of all the changes we saw in the hospital. So it's been an epic year. I think it was Stalin or Lenin who said that, sometimes weeks go by and they seem like years, and then a year goes by and it seems like a week. And that's kind of how this feels,
How about you, Eric? How do you feel on this 1 year-ish anniversary?
Yeah, I think back to February 29th was the first death in the U.S. And there was a sense of denial that it was going to go away somehow. And in conferring with my colleagues, one of whom is particularly an expert in outbreaks and pandemics, Christian Anderson, he said, it's coming, it's going to be big and bad, and was he ever right? So, it's been a year of tragedy, which also now we see the light with the effects of vaccines, which really are a miracle. In fact, just today, I was discussing with a fellow who I thought was actually very intelligent. I said, are you going to take the vaccine? He said, no, it happened too fast. I don't trust it. So you just can't win. You have something that is truly one of the greatest triumphs of medicine and science research in history. And you have people thinking that there's something wrong with it because it's so good, too good to be true. So, it's kind of the best and worst all packed into 1 year. But I think it's exciting to know that we're moving, towards an exit ramp of some kind.
It's interesting to think of COVID as its own narrative, as its own story. I think back to where we were at Bellevue a year ago in March. We really thought, this was going to be like Ebola. We were set for Ebola. We had our E unit all ready, with 4 isolation rooms. We could handle whatever comes through the door. Ebola, some other hemorrhagic fever, yellow fever, plague, it comes to Bellevue, and we have the resources for them. That was really the thought. We have the E team, the Ebola team all ready. And then the rest of us will just keep doing our stuff. And I think we did not have the ability to imagine how the story would play out. And each day it was like, the page just kept turning. And, when you talk about a page turn, this was it. Every day was a new, dramatic action. And looking back now after a year, so much has happened, so much grief and sadness, but also so much written. And I'm really intrigued, I think we all are, by the written word in its various forms. And I'm wondering, maybe Abraham, you could take this first, when did you first notice sort of an uptick of writing, either journalistic or literary, social media, as the pandemic unfolded that made you think, we're someplace new?
Yeah, I think it was evolving so quickly that the kind of, writing that we might be used to seeing that really developed their theme really didn't work, I would think, because I mean, I thought it didn't work because they simply didn't have the information. And so I found myself much more inclined to reading people like Eric, for example, who were, topical, and it was changing every single day, even as it is right now. So I think it really represented a shift for me, at least, in recognizing that the sources that I might go to were already old by the time I saw them, compared to, say, Twitter and more immediate sources like that. So that was the big change for me. The other,
I'll actually second that, because I mean, from up until, last year, I really saw social media as sort of like, fluff on the side. There were some fun and witty and cute things, but it didn't really exist in any needful way. And this was the first time where I saw the real utility of this. And I agree that, Eric, you were one of the lifelines there, that the information was coming out. I mean, in the best of times, I don't have time to keep up with my journals and all the reading that we should be doing. So I rely on Journal Club and colleagues. But in this environment, when really things were changing so quickly, it was really helpful to have someone, like you and many others. And maybe you could talk to how if you saw your social media life change during COVID.
Oh, no question. Danielle, back in late February or March, I kind of made a conscious decision that I was going to get deep into this. It was kind of a natural, since I'm an information junkie, and I, look at journals and the newspapers and, whatever sources to see if I could help provide some navigational component for us, for at least the science medical community, if not other people who wanted to follow. So I started, I think double or triple the number of posts I would do in a day quickly, and that's been maintained, for the year since. So, it kind of took over my life, because then, if I wasn't putting a lot of information out, people thought maybe I wasn't alive or something. Something was wrong with me.
I did want to ask, how many hours a day do you spend, or did you spend during the peak of the pandemic? I mean, the things you put out there were thorough, researched. You had clearly read the whole paper, highlighted the information. Was that your entire day?
No, but it is, I get up early just so I can read. So I usually do 2 or 3 hours of reading early in the morning. And then, it's not much during the day, a little bit here and there. And then in the evening, again, it's another few hours. So, it's mainly the beginning and ends of the day that I'm able to get the reading in. But the other thing I would just point out is I archive. That's the way I keep track of everything, is through Twitter. So, that's perfect for me. It's not only sharing, it's also helping me, because then I can find stuff again.
Oh, really? So that's your file cabinet now?
Yes, it has been off for the last 11 years. So it kind of got convenient, because, even though I was putting up a lot more stuff, it helped to have it all so well organized. I could get to anything I wanted. That turns out to be really helpful when you're trying to figure out, what you barely remember from, week or month or whatever earlier.
is that something, Eric, that you do through Twitter? Is that a function of the Twitter, or something you do separate from it?
No, through the Twitter. There's a mytweets.net, and basically have it all filed in there. And if I just put in the topic, the hashtag or whatever, and any extra word, I can find, any one of these tens of thousands of whatever tweets about COVID. So yeah, no, it's actually a really great way to keep track of stuff.
That's wonderful.
Yeah, the other big thing I found on Twitter mainly was the educational aspect. I mean, there was a real switch to like a very, in some ways, old-fashioned way of like the quick on-the-fly journal clubs. I mean, there were little tutorials on vent management, ABG refreshers. I mean, things that I really needed, and I found them so helpful. Or discussions about what people were doing, proning, how to interpret X-rays, in the age of COVID. And that, I had not seen that before, and maybe I had missed it, but I found it in a utility, in a way of, and getting an educational little tutorial from someone in Italy, that I hadn't never met before, but now they could teach it from their experience. And Abraham, I mean, you are so involved in education. Do you see this as changing somehow the way the educational model we're going to use?
I think it already has. I mean, the other thing that happened for us is that our grand rounds where we would have, maybe 200 people, became this event where we had 1,000 people, and it was all by Zoom. And I can't see us going back to the old model without combining it with some sort of function like that. I will say though, I'm certainly not a Twitter expert. I read a lot of it, but I've never really quite got the hang of it, as Eric likes to tease me. But there's an important function that we all exercise, consciously or not, where you really have to filter out the stuff that makes its way to Twitter, that you wind up looking at, because something's been retweeted by someone and this filtering function is so key. You really have to listen to the people you want to listen to and start making value judgments about some of the other stuff you hear, that you begin to realize, well, wait a minute, this is a bit more on the fringe than I am ready for, and that was interesting to me.
Yeah, although sometimes wonder if because it is sort of pre-filtered by who one follows, who one doesn't follow, whether you're not ever learning, there's a whole other thing out there that maybe I'll never learn about, because somehow our little worlds don't overlap. And you can make the analogy politically or socially, other things, but even just educationally, that maybe I am not missing out on the people who are reviewing these other journals and I'll never learn about them. And, that's just happenstance because of who I happen to be following.
Yeah, one of the things that the bright spot, I want to acknowledge what Abraham mentioned, the bad information, disinformation stuff is certainly an issue that has to be dealt with. But what I have found especially stimulating is this transdisciplinary, making friends and having, all these new synapses worldwide. So I just yesterday I wrote a piece with Roberto Birioni, who's the Tony Fauci of Italy in medicine. And he's become a good friend. And I had no idea that some 25 years ago, he was at Scripps Research as a postdoc. Yeah. And Eddie Holmes in Australia, and all these different people in different areas, whether it's virology, immunology, structural biology, just goes on and on. So it's been the most intellectually stimulating time of my life. And I don't even have any background in any of this stuff. I don't know anything about infectious disease or immunology, virology. In fact, I used to avoid all that stuff. But it's very interesting, it really is.
What Eric has done so well in our podcast, Medicine in the Machine, Eric has really brought to us, or introduced for us, scientists who I think, I'm not sure I would ever have known of them, but their voices had emerged on Twitter as being reliable sources of information in epidemiology and virology and, in various fields. And I think, I sort of got to watch Eric, do that, sort of find the right voices on Twitter. And if you're following him, then you wind up learning about these other folks as well.
And I found actually a parallel issue, if I can switch the conversation a bit, to sort of the literary writing or journalistic writing that came out of COVID, of which there was a lot. Many people wrote about their experiences. They were so intense. And I found it was a way to learn about what other people in the hospital do. Nurses were writing, physical therapists, respiratory therapists, cafeteria workers, nursing people working in nursing homes, things that you might not come across in your daily little world. And talk about interdisciplinary, I felt that there was this chance to delve into the world. Right now in the BLR, we're publishing this fall, 2 of our prize-winning essays are fiction, and one is by a physical therapist who writes a piece about a physical therapist during COVID. I never really sort of thought about the physical therapist connection to the patient and how that works. And then another piece that we're publishing is the public health worker who's sent to go talk to some recluse and let them know about the pandemic and try and get them to wear a mask. And some poor young recruit who draws the short straw has got to go out into the countryside and deal with an ornery old person. I didn't really think about what those people do. And I think there was quite a flowering of narrative writing and essay writing. And Abraham, anything that you've read or perspectives that have caught your eye?
I think very much like you, I was, intrigued by many of the personal narratives. There are so many of them, and again, you need the filtering function. I must say, I think I found it really helpful to reach back to, older narratives and make comparisons, whether it was, Camus' The Plague or the Decameron. and find that, as much as things have changed, some things haven't changed at all. And I've been really intrigued by the dissonance between the wonderful science that Eric talks about and the sort of degree of social discord and disjunction between that and the real scientific facts. In fact, maybe unlike some of you guys, I actually sometimes search on Twitter under names like Scott Atlas, who's one of our former colleagues here, just to see and to sort of remind myself how we can make all these advances in science, but if we don't make advances to change the narrative that affects behavior in such negative ways, we really haven't advanced that far from Camus, who said there have been epidemics forever, but it always comes as a surprise, and there's always this other element that you have to deal with beyond the plague itself.
One thing, Danielle, that I noticed throughout the pandemic is the Atlantic magazine. I had never seen it shine like this, but it had such extraordinary pieces on the medical side, the science side, every aspect, whether it was Ed Young or Zeynep Tufekci or, so many people there have written some extraordinary work, some major long reads that are, like multiple book chapters, but, well worth it. I was surprised how they really came to life in so many respects. And also that they got behind the data tracking. So interestingly, the CDC had failed, didn't even show up, but they sponsored this COVID-19 tracking project. So for a magazine to contribute in that way really differentiated them, from so many others prior to the pandemic, at least, in my opinion.
Yeah, I actually felt the same way about the New Yorker, which seemed to be almost like a scientific and social resource. There was such intense writing, both, sort of on the ground first person writing, but also just scientific background. I found it educational. And in fact, when Lawrence Wright had his last piece, The Plague Year, which I think was maybe 70,000 words when it turned out was still 35,000 words. I almost didn't read it thinking, oh, can I live through this again? It was riveting. It was absolutely riveting. And then I realized he had published a novel about a pandemic just, in 2020. And now here he was writing the nonfiction counterpart.
Oh, you're right. That was the whole issue. It was amazing.
It was, and actually, maybe we could step back a little bit, as Abraham intimated, and think about some of the other things that we have read, in the past. And I thought a lot about Jose Saramago's Blindness. The plague of blindness as this metaphor, and I wondered how many of us became blind during this epidemic, blind to facts. And right on the one hand, as you say, the medical profession, the healthcare world actually became quite unified during this. We really were in this boat together in a powerful way, but at the same time, the world around us seemed to shatter, and the amount of blindness just staggered me. And I'm wondering if you want to share anything that you've thought about that's reflected upon what we see today.
Maybe I'll begin by saying that I used to teach Camus' The Plague in various different settings. So I thought it was a book that I knew well, but I saw it in an entirely different light this last year. I actually saw the genius behind it. Here's a guy who, I don't think he actually lived through a plague. This was a imaginary town based on a city in Algeria. But he really anticipated all the social ills that we saw. And I think there were entire passages of the book that I had read before without really appreciating what he was getting at, and seeing it sort of come into play, this year with us. So, yeah, I think that to me, that was still the most intriguing story for me, is the social discord. And I'm a very slow writer, as you know. So I think it's going to take me a long while to sort of translate this into something meaningful, whether it's a short story or whether it informs a novel. But I think there was a great deal to learn there.
Yeah, you yourself have said often that describing fiction as the great lie that tells the truth. And I think
Indeed,
these are some examples. Love in the Time of Cholera also comes to mind, in the way that magical realism, which you would think is just the wrong thing we need at a time when we need facts, but sometimes the magical realism feels like it explains things in a way that the actual facts don't. And I was thinking, the other things I was thinking about is all the writing that took place during the AIDS epidemic. sort of generation before, there was a lot of, I think, healthcare workers who for the first time were writing, and journalists I was thinking about, and the band played on, and how that was sort of formative in shaping the narrative of the epidemic for history. That became the draft of how we look back on it. And I think we didn't really have it till people wrote about it. And I, wonder who will be writing the book on this narrative of our current pandemic. And maybe it's going to be this collective narrative that we create with all of these strands of writing.
My suspicion is that, the HIV epidemic was very special. It's really began affecting very discrete groups, and their voices were already not being heard very well. So, for example, for me, it was my first awareness of, I was not homophobic, I was homo ignorant. Yeah. And all of a sudden, as an ID physician, I became intensely aware of gay men, and, had so much that I learned from them. So I think the literature around HIV was also very much literature about gay men and about their lives and about their struggle and being marginalized. I suspect this epidemic, to me, it will be much more like something like the Great Depression or World War II, where, as you said, it's going to inform all narrative. It's going to infuse itself in, generations of kids, or at least this generation of kids and adults, every time they talk about their lives.
Yeah, I mean, there's been a couple of pandemic books already out there, one by Nicholas Christakis and another by Fareed Zakaria. I think it's premature to write the book on the pandemic and to try to predict where we go from here, because we're still in the midst of it. I mean, I wish we were further along, but, hopefully, later this year, we'll have a better sense. I also think that the idea of being able to avoid something like this in the future. I came across this thing written today about, actually in National Geographic, about this being described as a natural disaster when it actually is a man-made disaster, and how we aren't putting in enough nearly effort towards climate change and all the things that we're doing to our planet that induce this sort of thing. So, there's just so much we can learn and hopefully, avoid this catastrophe in the years ahead. So I'm still waiting to see. There'll be so many books written, I'm sure. I'm waiting to see the book. I actually, either one of you could do it. I know that.
My money's on Lawrence Wright. He's halfway there.
One narrative we didn't talk about, Danielle, which I think is important to point out, is really the healthcare narrative. I mean, you alluded to it, but the initial period when our house staff, especially, in all the various hospitals, especially in New York, were under so much stress and under so much personal risk while dealing with their own families. To me, that was a very poignant story. And, we couldn't quite be in their shoes. We were always, as attendings, always one level removed in a sense. And I think that this is going to color the way they shape medicine in years to come, the style of medicine. I don't quite know how, but they really have been battle tested and altered by this in a way that perhaps you can share your own view on what's happened with the house staff at Bellevue.
I think this will be their defining sort of characteristic of the kind of doctors that they are. And I think it will, I believe, create a certain resilience of just being flexible, that, things are the way they are. That's not good enough. To be able to move on a dime is just a different way of thinking, and that knowledge is very fluid, and maybe there'll be less sort of, kind of ground in, cemented into certain views because they're used to being in a changing environment. But I think, as to what you mentioned, that, psychologically and personally, I think many were harmed in a way that maybe didn't happen for other generations of trainees who weren't, put to this, to be put at that risk, and often without the recognition or a remuneration that was deserved. And I think about also the medical students, many of whom were graduated early and tossed into the fire as well. And then I think about all the the nurses who were traveling from other places and came voluntarily to New York during our worst of it, or traveled to other places that needed it. what an experience. And of course, some of them, many of them did contract COVID, and not a small number perished, around the world. It's not a small number of healthcare workers. And that part is heartbreaking when you see that people have gone, to do something to take care of people in the most difficult circumstance and have gone ill or have died. That's a tragedy that I think a lot of generations of trainees have not faced. So this is really something I think significant for this generation.
Well, something that also came out of it in a positive way, not only was there a common enemy, the virus, for the healthcare workforce, and it's already mentioned just extraordinary writing about people's experiences. And as you say, Danielle, not just physicians and nurses, but the entire profession, including, as you say, physical therapists and pharmacists and paramedics and, on and on. But what is striking is not only this was occurring on top of burnout, there was already a global burnout crisis. And what could have been the result without protective gear and with all the things that you would have thought would be the priority, could have been the turning point of the worst time in medicine. But in fact, it was a rallying cry. And what's interesting is more applications for medical school than in history, that it actually put the profession out there to the public and to young people to be an alluring path, which is really striking because, as you say, put at risk, put in the fire. And then more and more people, now are craving to be physicians. And I think that's probably true across other specialties in healthcare too. So it's fascinating what the impact had actually over time.
Right. In some ways, it's changed the story of what it means to be a doctor or a nurse. And I think we had kind of a couple of generations in there, a couple of decades where it was a little confusing as to what is the narrative of a healthcare worker. A lot of it, there was issues about money and reimbursements, and a lot of it was technocratic. And I think a lot of the burnout did come from that. And this reminded us of the sort of the really baseline of what it means to be in healthcare, of taking care of patients. Our medical director, Nate Link, just published a book called The Ailing Nation, where he looked at our nation as though the U.S., as though it were a patient with a chronic illness, and kind of took the chief of medicine kind of look at it, which is a fascinating book. But one thing I was just reading an excerpt that, when it came to the COVID pandemic, listen, people in the hospital, we've got different political views and personal views, but when it was time to take care of patients, all that was dropped. Like there was no question that everyone puts all that aside because that's a profession. That is what you do. And there's no doubt that would happen. Whereas, in politics and many of our leaders, sadly, that was not the case. They didn't drop everything and say, okay, we have this most important thing. Everything else is secondary. And it reiterates, I think, why we're all in this profession and why people want to be in it, because there is a moral clarity. And I think a lot of people during the pandemic were suffering from a not just boredom, but sort of a lack of purpose. And that was the one thing we didn't have that problem. We had, more purpose than we needed and more to do. But there's something that I think helps us with the morale. And I won't, at all want to, paint over the other difficult issues in healthcare now and the true burnout that is still there and the moral injuries that are still there. But it was helpful to get that reminder of really what is the underpinning of the profession. I was going to shift back. Another book that I was looking back at, it's from a couple of years ago, called Contagious by Priscilla Wald, who I think is an anthropologist or sociologist. And she was really interested in this idea of the outbreak narrative. Like, why do some illnesses, take hold? And she was positing that what makes a certain illness really grab us is it's got this sort of this outbreak narrative that it comes from deep, dark, the primitive world, and then it emerges out and it takes over the civilized world. And so, you end up with, movies like Hot Zone that, this grab you, Ascaris, malaria. No one's making, big movies about diarrheal illnesses that, kill as many or if not more people. But, and COVID, a little like SARS and avian flu had a bit of that too. And I think we saw that in the beginning that, coming from China and from the markets. In fact, I had a conversation yesterday in clinic with a patient about the vaccine. And she said, I don't want to get it because it comes from bats and rats. And I was really trying to explain that although the virus came from bats, that the vaccine doesn't come there. I could not convince her. It came from bats, and I'm not putting, bats and rats in me. It's such a powerful narrative.
I remember, when I first came to this country in '74 for the first time, the movie that was playing was Jaws, a blockbuster by this unknown director, who's very well known now, as you know. But it was a monster from the deep, and it came up and terrorized this small town, and a couple of people stepped forward. And it was pointed out to me in a book I was reading recently that this is really the original oldest narrative in the world, the narrative of Gilgamesh, recorded on cuneiform script on 20 stone tablets. It was about a monster, Humbaba, and the hero Gilgamesh, and he gets special powers and special tools. And in a way, we've been retelling that story ever since, and you're right. I think there is a monster narrative. And the nice thing about those narratives is that it's never just one hero stepping forward. They step forward and they find resources within themselves, or they find, special powers and special tools. And it's never a coming back to where you were. You defeat the monster, but you are now transformed. You're in a new place. And I think that is very applicable to where we are with COVID. We're one day going to get to normal, but normal isn't going to look like what normal was before this all began last February.
I'm wondering if you see writing as changing as a result of this. I'm thinking, like, Abraham, how do you immerse yourself in a novel when there's a novel playing out, right around you all the time? Does it change how we write?
Well, it's a good question. I mean, I'm reading a lot of good writing, but I'm also reading a lot of bad writing. There's a lot of, there is nothing stopping anyone from writing anything and publishing it, whether it's on a blog or self-publishing. And so, again, it's very much like Twitter. I think you have to use the filtering function. But I think, stories are fundamental to our lives, and we gravitate to ones that resonate with us, typically because they're giving us some instructions for living. And it can be a timeless old masterpiece, or it can be something current, but there is a standard. And I think it's clear that you have to meet the standard. It's not enough to be just topical. You also have to fulfill these elements where the reader comes away satisfied, transformed, shares the epiphany that the hero shares. So those things I think are pretty timeless. They're human characteristics. The form changes, the topic changes, but the elements, I don't think, change that much.
I wonder if the experience I've had is that people are reading less. Their attention span is less. And there is, as Abraham points out, no shortage of writing. I mean, every which way you can find things. But the ones I find most helpful and what I try to emulate are the ones that are succinct and astute. That is, they really convey some unique insights rather than just regurgitating something, or other. Because otherwise I feel like it's just not helpful. I think it's hard, at least for me, to try to write anything long these days, just because there's so much going on, as you touched on. And, there's a novel, there's a movie going on, and it's been a horror show, and hopefully it's going to be a happy ending show out there. But, I think the attention span was bad before, but I think it's even worse now.
So are you writing a new book now, Eric, or you've given up, you're just going to do Twitter?
Well, I've thought about it, but if I did do something, obviously I'm absorbed by this. It would have to be something, I have no plan for it at this point, but it has to be something where I really thought I could contribute something meaningful, that it would fulfill those kind of criteria. And I haven't yet come to that. I mean, there's going to be so many books about how the United States, effed it up so bad. I mean, that.
Right.
But I don't want to do that. I mean, that's just, but if it ever came as Abraham said, an epiphany of an angle that was just, really unique, maybe. But no, at this point, no plan.
I mean, here's my one thing. I mean, I appreciate that everyone's attention span is short, and so social media sort of fills that. And I think with COVID, we wanted those quick things. But what I find that social media lacks is, where does the nuance come in? What happens with ambiguity, vulnerability, which I think so much of that came up during this pandemic, and that doesn't translate well into 140 characters. I think we need the poets and the novelists and the people to write the 35,000 word articles to delve into them. And although we all say, oh, I can't read another book, how is social media going to do that for all these other parts that the pandemic brings up?
Yeah, well, that's the storytelling that you're not going to get. At least they went up to 280 characters, but no, there's no storytelling on Twitter or any social media. But that's what, that's why when I mentioned Walter Isaacson's book, Code Breaker, he's one of the great storytellers. I mean, the people that can do that well are worth our time and our, delving into. But yeah, I mean, the ambiguity, should you wear a mask? Should you not wear a mask? How important is ventilation? Not important. All the schools opening, closed. I mean, everything you could think of, there's been ambiguity. All at some point, if not constant ambiguity. And you don't get that straightened out, in a 280 character post or many posts. Absolutely.
It makes me think, if I can put in a pitch for one thing that's both concise and can be brief, but also can pull in nuance, ambiguity, I would propose poetry. I think poetry has that unique ability to sort of dispense with the sort of fact-based narrative and take some essence of something ambiguous or vulnerable and pull that right out by using metaphor. And I know we have a fraught history of thinking about illness as metaphor and whether that works or not. But maybe this would be the golden age of poetry, that this is a way to deal with both a short attention span, but why do we read literary journals? If I have a stack back here, why do we want these things? Because getting those little facts about what the data are not enough. I mean, we need those are important, but the difference between curing and healing, you can give the right antibiotic, you can cure that disease. The patient may still be miserable. We've missed, something else is still there. And, 500,000 people have died. Millions have survived COVID, but many of them still are in need of a lot. And the fact that they've survived the disease isn't sufficient. That's obviously necessary. And so I will put in the pitch for poetry, or maybe the novella will be the new thing.
Well, I'm like you. I love poetry. And I think one definition I once heard of poetry is it's when the head and the heart are saying the same thing. And poetry has that ability to sort of connect the facts with the feelings when it works well. Unfortunately, poetry isn't widely read. It doesn't take the country by storm the way a movie or a novel does. It should. But I find myself getting quite a bit of solace from reading poetry. And, we talked about all the different forms of narrative, but there's been some interesting poetry, being published in many of the literary journals in the New Yorker and elsewhere that have really echoed the times in a beautiful way.
Yeah. I mean, if you think about Amanda Gorman's poem that she read at the inauguration, that took the country by storm. And so, one thing we haven't touched upon yet is sort of the intersection of the COVID pandemic with the recognition of systemic racism, the delayed reckoning of that really came out with the murder of George Floyd. And I think that brought in a sort of another sort of current of writing that, I think wouldn't have happened without COVID. I think it wouldn't have been received in the same way. And it may have just gotten signed. There was something about these things happening together that was incredibly powerful. And I think, and her poem really demonstrated how you can pull that, because you're right, there's going to be, encyclopedias written about this, but in a short poem, I thought she captured so much of that in a way that you could not look away.
Oh, what she did for poetry in this country, if not beyond, is extraordinary. And I agree completely with you about this. I wonder, where this is headed, but the power of poetry perhaps has been in this era has been especially more pronounced. And as you say, the novella, these shorter ways of conveying powerful emotions, but also, who would have thought the pandemic was bad enough? Did we also need George Floyd and all this to also, to add to this yet another dimension of catastrophe, into a reckoning, which is still obviously never been adequately addressed. So yeah, the depth of what's been going on here in this past year, I mean, I just can't imagine that, so many different dimensions of horror that we've been living through, and how we can get so numb because it's so much at any given moment or time.
I mean, it brings me back to Saramago's blindness, that, we do have an epidemic of blindness in so many aspects of life. And reading a book like that, written years before all of this, to me feels so relevant, because it feels like a way of, maybe that's where we are right now. And I don't have another way to put it into words. So I guess we're drawing to our close. And I guess I'll sort of end with, for our listeners or audience, who would you recommend that they, read now, either from the ages or going forward? Who are people that we should keep an eye on, either a name or a class of people that we haven't heard from that you think might be important to sort of help us advance this story, this narrative of COVID?
Well, I think since we started on that theme, I think making a plug for poetry, making a plug for African American writing, which I think has always never gotten the recognition that it needs, whether it's James Baldwin or many of the contemporary writers. I think there is so much there that we can take away, and this is, for me, this is the year for it. This is the time for it. So I'm doing a lot of that sort of reading.
Well, besides the two of you, I think that, I saw the segment on 60 Minutes of Colson Whitehead. I'm really stimulated to read his novels. They seem to be extraordinary. I haven't gotten to it yet, but it's certainly on my list. I think as far as insightful people like the kind of prescient, there's Zeynep Tufekci would fit the bill. She's a Turk who has this, very unusual background in internet and kind of social aspects, but she seems to get everything right. It's just kind of amazing. And she's outside the whole world of medicine and science, but she keeps on coming up with the right, a couple months ago, she wrote an op-ed in the New York Times with Michael Mina about we should be thinking about one dose of the vaccine as a temporizing measure. And now it's become, right, critical. She questioned mask and ventilation. So I kid her. I told her middle name is Prescient. And so she's one who I follow now, who I've gotten to know as a friend over the course of the pandemic.
Yeah, I found it interesting, for BLR, we read manuscripts that come in from people, and they really are a reflection of the times. We get about 4,000 submissions per year. And, the batch that we're reading now has been really fascinating. There's a lot of writing, fiction, nonfiction, poetry, those are grappling with those issues. And I'm really looking for voices we haven't heard from. I think about the nursing home crisis, and we've heard so little from the people who work there and the conditions that are next to impossible. And I really want to hear those voices. And I think from, many of the countries who haven't had a lot of say, as we're watching the vaccine rollout and the inequities in that, from international writers who have, experienced it differently than we have. We often have blinders for where we are right now. And I'm just interested to look at those other places. So I'm going to thank you both, Abraham Verghese, Eric Topol. I'm Danielle Ofri, and this is the Bellevue Literary Review. I invite you to check out BLR, and I'll also give an appreciation to Medscape for co-sponsoring this event. And I hope you found it helpful, and please be in touch if you have questions, thoughts, you know where to find us. Thank you so much.
Thank you.
Thank you.